Hi, I'm Dr. Michael L. Johnson. I'm a board-certified chiropractic neurologist. I've been in practice since 1983 in Appleton, Wisconsin. I'm the author of this book, What Do You Do When the Medications Don't Work? A Non-Drug Treatment of Dizziness, Migraine Headaches, Fibromyalgia, and Other Chronic Conditions. I consult with over 1,000 chiropractors across the country. And you can locate the doctors that I consult with along with testimonials at lifechangingcare.com, www.lifechangingcare, all one word, .com. I'm here today to talk to you about digestive issues. And I know digestive issues personally because I used to have them until I addressed things metabolically and neurologically. What do I mean? Pain, bloating, loose bowels, constipation. So you need to address the issue metabolically and neurologically. It's the right and left hand. So, what makes us different from every doctor you've ever seen? That's just it. We treat you metabolically and neurologically. We don't leave any stone unturned. And what we want to do is, let's start with the metabolic side because that's important and you're going to see why. We want to get complete blood work on you, not narrow panels like your MD may have done. And keep in mind, you can look at me and say, Dr. Johnson, my blood work's normal. They said it's all normal. There are lab ranges which are very broad. I want to say extremely broad in some cases. And there are optimal levels that are much narrower. Your thyroid, for instance, the TSH level, thyroid stimulating hormone, your thyroid drives your body metabolism. And what happens is that normal lab range is 0.5 to 5.0, where optimal level is 1.8 to 3.0. So that's a huge difference. So how do I successfully treat these digestive issues? Just what I'm telling you. You want a lipid panel, a complete metabolic panel. You want a CBC, complete blood chemistry with auto differential. And you want a complete thyroid panel. You just don't want to measure just TSH like a lot of doctors do. You want the complete panel. Free T3, free T4, total T4. You know, you're watching this video because you or someone you love has a severe digestive issue. So we can assess your thyroid, adrenals, liver, kidneys, red and white blood cells, gut function. All these internal organs just with the blood test. Now here's the biggie. There's two biggies here. And this is one of the first biggies in the metabolic side. Sensitivity testing. We want to check and see if you're sensitive to gluten. Gluten is wheat, rye, oats, barley. We want to see if you're sensitive to milk, soy, eggs, or yeast. You could be sensitive to one or all of them. That is causing a lot of your digestive issues. You don't know unless you test. So here are some of the symptoms of these sensitivities. Chronic pain or fatigue, frequent indigestion, bloated after eating, frequent loose bowel movements, constipation, diarrhea, mouth ulcers, or they vomit often. That's why you run the test. I just had a patient yesterday. She came back with her lab. She's autoimmune, and we'll tell you what autoimmune's a second big part of this. But she's autoimmune, and she's sensitive to all of these: gluten, milk, soy, eggs, and yeast. I've had this test done. And I am sensitive to gluten, milk, and soy. I'm also autoimmune. We want to look at your adrenal glands. Your adrenal glands via adrenal stress index. Your adrenal glands sit right up above your kidneys. They're your stress glands. We want to look at your immune panels. Yeah, autoimmune, what does that mean? Your immune system is attacking part of your body. In this case, it could be your digestive system. You don't know unless you test for it. There's two parts to your immune system, Th1 and Th2, and they have to work together. And the markers, it's a blood test for Th1 is interleukin-2 and TNF-alpha, and the markers for Th2 is interleukin-4 and interleukin-10. If that's high, you have a dominance. You have an autoimmune condition. Then you want to find out what's causing that autoimmune condition. Is it caused by an antigen or dysregulation? What do I mean by that? Well, your Th1 system is T cells. T cells attack an invader. like an antigen. There are helper T cells, suppressor T cells, natural killer cell activity, regulatory T cells, and macrophages. Th2 are B cells. B cells make antibodies and tell the T cells what to attack. Now, what are active antigens? Active antigens are parasites, bacteria, virus, mold, yeast, fungi, protozoan, foods, the sensitivities, chemicals, and heavy metals. I've had patients where their problem has been problems with parasites. I had one girl, she worked in a vet's office, a veterinarian's office. Her eosinophils were through the roof. And that was causing her problem. Eosinophils normally, ideally, optimally are 0 to 3. She was like at 54. She had a parasite. So there's a test that you can run, a stool microbial test, that will tell you the specific parasite. And then you can address it. Now that has to be addressed with medications. I would send you back to your medical doctor and have you get a medication to take care of those parasites. But I'm saying, you see, there's a lot of possibilities here, and you have to test for it. If you have chronic gut function problems, you need to be thorough. And most MDs they just blow it off. They pass it off. So the best indicator for an active antigen is the cause of the patient's abnormal Th1 or Th2 dominance is the helper-suppressor ratio, the T cell ratio, also known as CD4 and CD8. And if it's 2.5 or above, guess what? You have an active antigen. If it's 1.2 or below, guess what? It's a problem with dysregulation, an anemia, an adrenal problem, a blood sugar problem. You don't know unless you test. You don't know unless you're thorough. You could have a problem with H. pylori. Let me tell you something about H. pylori. You know, when this was first brought onto the scene in medicine, many doctors poo-pooed it. Oh my goodness, bacteria can't be causing ulcers. Well, guess what? It did. So you can test for it. That H. pylori bacteria could be the active antigens that's causing your problem. You don't know unless you test. You could have a problem with intestinal permeability, leaky gut syndrome. It's a condition caused by damage to the bowel lining, and that's caused by antibiotics, toxins, poor diet, parasites, infection. We may want to look at your neurotransmitters or your hormone panels. We're definitely going to look at inflammation. I'm sure you have inflammation in your gut if you have digestive issues. So we're going to look at C-reactive protein and homocysteine. And then we treat you nutritionally, and we treat you with something called glutathione. Glutathione is the mother lode of antioxidants. But we also treat you neurologically, because guess what? Your brain and nervous system control all bodily functions. And it's your lower brainstem, the pontomedullary area, via the vagus nerve, that controls your gut function. So you have to treat it metabolically and neurologically. If you're not doing both, you're never going to get truly better. So one of the things we do neurologically is exercise with oxygen therapy. Your brain and nervous system need two things to survive: fuel and activation. Fuel is oxygen and glucose. So we get you exercising with oxygen, either on an upper body ergometer, it's like a bicycle for your arms, or an elliptical machine. We use brain-based therapies. We want to increase brain function if there's a neurological problem. So ask yourself the following questions. How has your digestive condition affected your job, relationships, family, finances, or other activities? I had a lady, she had such problems with diarrhea. And she was another case where it was parasites. She couldn't go anywhere. She couldn't go to any functions. Couldn't go to her kid's basketball game or football game because she would always be running to the bathroom. She was like 39 years old. Had to wear Depend diapers. Came into my office crying. And like I said, her problem with parasites, we addressed that. Her problem in her case was she was sensitive to eggs and soy. We got her off eggs and soy. We treated her nutritionally. She got better. So what has it cost you? What does it cost you in time, money, happiness, and sleep? Where do you picture yourself in the next year to 5 years if your digestive problem